Hello and welcome to this video. My name's Kris, I'm an Australian GP, and today I'm talking to you in a three-part video about my favourite topic of all time, pregnancy. This is going to be video number 1 in this series, talking about congratulations, you're pregnant, now what? So what to expect in the first trimester. Video number 2 will be about all of the things I like my pregnant patients to know in their first visit, about the do's and don'ts of pregnancy. And video 3 will be about all of the common discomforts in pregnancy and how to manage them. Of course, this is very broad and everyone's pregnancy journey will vary depending on them, how many pregnancies they've had, what kind of pregnancy they have, is it one, is it twins, is it triplets? So do be aware that this is all general advice. Without further ado, let's get into video number 1. As a GP, when someone finds out that they're pregnant, I'm routinely one of the very first people that they tell. This is an utter privilege and a very exciting time, but I also acknowledge it can be a very anxiety-inducing time for a lot of people. I've also come to find in my career that a lot of people don't know what to do when they find out they're pregnant. They get really excited or really anxious, and trust me, every response to you finding out you're pregnant is completely valid. But often they don't know what to do next. Some will tell their partners, some will tell their family, and that's all well and good. But then there's a lot of, what should I be taking? Who should I see? When should I see them? When do I get a scan? And that's what I want to talk about today. I truly love pregnancy. Although, to be fair, I've never experienced a pregnancy personally, so my views may change if and when I do have a pregnancy myself. But as a GP, I love it. For some, pregnancy can be an exceptionally exciting time, especially if it comes after months, if not years of trying. For others, especially if it is an unexpected or an unplanned pregnancy, finding out that you're pregnant can be exceptionally anxiety-inducing and even fearful. You are allowed to feel whatever it is that you feel when you find out that you are pregnant, so there is no judgment ever. You are not a bad person, let alone a bad parent, if your first reaction when you find out you're pregnant is not, yay! Pregnancies are routinely divided into 3 trimesters. Three, you get it. Trimester 1 is typically 1 to 12 weeks. Trimester 2 is 13 to 26, and trimester 3 is from 26 to 40 weeks. This, of course, is because pregnancies are typically a 40-week experience. Some people will have pregnancies that last 36 weeks, and this is considered full term, and some people will be pregnant up until 42 weeks. There's a lot of nuance there, and obviously I'm not a gynecologist or an obstetrician, though I do have an interest in it. So I won't sit here and talk to you all about the pros and cons of delivering at what time. Just know pregnancy, typically 40 weeks, divided into 3 sections. Most people find out they're pregnant after a missed period, but I do acknowledge that some find out because they feel nauseous, or they have tender breasts, or they have food aversions, or the common signs of pregnancy. At the time of your first missed period, technically, you are 4 weeks pregnant, even though you've only really missed 1 period and you ovulated 2 weeks ago. This is because we calculate your pregnancy beginning to the first day of your last menstrual period. So if typically most people ovulate halfway through and the average person has a 28-day cycle, you ovulate day 14, have sex around then, fall pregnant, you find out on day 28-ish, thereabouts, usually a little bit after because you've missed the period. So technically you fell pregnant 2 weeks ago, but technically you're actually a month pregnant. It's super confusing because every pregnant person doesn't necessarily have a 28-day cycle, nor do they have a regular cycle. Sometimes we'll offer you a dating and viability scan to confirm how far along you are. At the first visit, your GP will also order a slew of blood tests and a urine test. This is to check your baseline status and make sure that you're healthy in general. Every pregnant person will be tested for things such as hepatitis B, hepatitis C, HIV, and syphilis. And it's not because we have any suspicions about you, but because these diseases, when undetected, can cause significant issues in pregnancy. We will also test your vaccine preventable status for things such as rubella and varicella. We check your full blood count, make sure you're not anemic or having any actual. We'll check your full blood count to make sure you're not anemic, check your liver and kidney functions, a random blood sugar, and your urine to make sure that you don't have a UTI. For a non-pregnant person, a UTI, when it's not symptomatic, it's not necessarily the worst thing. But for a pregnant person, an undiagnosed UTI whether that be because you don't have symptoms or you're ignoring symptoms, can be very detrimental to the pregnancy. We may even check your pregnancy hormone, beta-HCG, but that's not always the case, especially if you've got a very clear urine pregnancy test that's positive, and then we order the ultrasound and we see the pregnancy. We don't really need to see the hormone levels. If you have the ultrasound, what we do is we date the pregnancy to see how far along it is. We ensure that it is in the uterus where it should be, and we find out if it's just 1, 2, 3, 4, however many babies are in there. The majority will only have 1. It isn't necessary, but most people who are pregnant like to have this scan. Because of how fetuses develop, we recommend that people have this scan at the 6 to 8 week mark based on the first date of your last menstrual period, because before this date, sometimes it's just a sac that's in the uterus and not really the beginning of a fetus development. And if there is, we like to see a heartbeat, which typically begins around 6 weeks. So cool, you've had your blood test, you've had your ultrasound, and you're back to your GP for your results. If all is going well, we'll discuss how you're going, what symptoms you've got, what we need to do to help you, and then we will discuss first trimester screening. This is essentially a screen for any genetic abnormalities that your baby may have, most notably Down syndrome, but there are other syndromes that we look for too. There are 2 main options when it comes to first trimester screening: the combined first trimester screen and the NIPT. The combined first trimester screen is the classical one that involves a blood test that looks at 2 hormones, beta-HCG and PAPA-A, and also looks at an ultrasound of bub to look for things such as a nasal bone and the thickness at the back of the neck. This is sometimes known as the nuchal scan. As for the NIPT, it's also known as the Harmony test sometimes, and it's one of the more recent tests that we're able to order. It looks at the maternal circulating blood and looks at any fractions of fetal cells within the blood that can help determine the gender of the baby, although technically no, the sex of the baby, as gender is the social construct. So it can help detect the sex of the baby and detect any genetic abnormalities in baby circulating cells. There are pros and cons to both tests, and both are immensely accurate. It really comes down to your personal preference. For the NIPT, you don't have to have an ultrasound, and it is a more expensive test. The combined first trimester screen isn't as accurate, but you get an ultrasound and a blood test. And you can also elect to get an ultrasound when you have the NIPT too, which may incur a cost. So really, it comes down to your personal situation. Either way, if either screening test comes up with any abnormalities, both tests will then lead into a definitive diagnostic test, which can be a chorionic villus sampling test, or CVS, or amniocentesis, which is testing of the amniotic sac itself. I'm not going to go into any more details about that. Just know that either the NIPT or the first trimester screen will result in a further test if anything is abnormal. From here, congratulations, you're in your second trimester. You've done it. For most people, this is when morning sickness starts to settle down. They start to feel like they're enjoying pregnancy. But don't worry if you're not feeling that way. You're not alone and there's nothing wrong with you. Typically in the second trimester, I as your GP will then refer you on to your next mode of care. So for some people, that's to a private obstetrician, to some it's a public obstetrician, and to some it's to a midwifery-led care model. The next big ticket item on your pregnancy checklist or to-do list is the 20-week morphology scan. And this is the scan where we check, does bub have a head, a nose, eyes, neck, chest, heart, hands, feet, toes, fingers, all of the good stuff. It's a pretty exciting time because it's probably the first time you've seen bub, and bub doesn't look like a gummy bear. It looks like a baby. At this point, depending on your risk, your pregnancy, your general health, your situation, lots of things can occur. The second trimester, generally there's not a lot of contact, and the third trimester varies significantly. So I'm not going to talk about it too much here, but just know that during your pregnancy journey, you will expect to have a glucose tolerance test to find out if you have gestational diabetes, a whooping cough vaccine to protect not only you, but bub against pertussis or whooping cough, which can be deadly in newborn infants. And if you are a negative blood group, so O negative, A negative, etc., you'll also expect to have a rhesus injection, which means that your blood and baby's blood won't interfere with one another. So that's it for part 1, guys, of this 3-part series on pregnancy. I hope you've liked it. Leave any questions below. I am going to be filming the next 2 parts right now. I'm just separating them for editing purposes. So if you do have any questions about pregnancy, I'll answer them in the comments below. But again, this is general advice. I cannot answer any specific questions about you or your health needs. So So until the next video, guys, stay safe, stay healthy, and I'll see you very soon. Bye.